Out of good health here at 5. The problem of concussions we've been talking about quite a bit, and it is a source of a lot of debate and concern right now.
And there's a lot of concern, too, on whether or not this publicity around concussions perhaps might be having an unintended impact. Our Dr. Frank McGeorge is here with a closer look on this issue.
Exactly, Karen and Devin. You know, if you think of concussion awareness as a pendulum, we used to be over here. Well, now we've swung to the other side, and many experts think we need to find a middle ground. Concussion awareness has certainly changed.
When I started in this field maybe 15 or 20 years ago, we would almost laugh at the person that had the concussion. Then we'd put them back into play 20 minutes later. Dr.
Stephen Broglio is glad those days are gone. He's the director of the Neurotrauma Research Lab at the University of Michigan.
We recognize that concussion is a brain injury. And we are much more careful about our management and how we treat those individuals.
But Broglio, like many experts in the field, is concerned that fear of concussions is leading some parents to pull their children out of many sports.
It's pretty obvious that as a country, as a nation, we've got a physical activity problem. I think when we start talking about eliminating sports or restricting access to sports, then that's just going to exacerbate that problem. We know for sure what happens when you lay on the couch and you don't get physical activity. We know what those outcomes look like, and they're not good.
While media reports have raised awareness, Broglio says some have also fed those fears.
Headlines are written in a way to draw people in and to get them to click, whether they actually read the article or not.
One example is reports surrounding the highly publicized study of NFL players.
So, for example, you will often see 99% of NFL players have CTE. Well, that's a falsehood. That's not true. We don't know what percentage of current or former NFL athletes have that disease.
It's true. Researchers found 99% of those tested showed signs of CTE, but it's critical to understand that all of the brains studied were donated by players and families already concerned about CTE. Broglio says there's also a key message the media is missing.
I think the thing that in the media that's not covered is really the improvements in the medical coverage and the medical care that's taken place in the last 10 or 15 years. We have a very standard protocol that most people go through. There's international guidelines on how to manage the injury.
Broglio believes in the future we'll understand much more about why people suffer concussions and how to prevent them.
We have a project where we've enrolled about 35,000 collegiate athletes from across the country, as well as some military service academy cadets, and our goal is to track them for the next 30 years.
As for the much publicized concussion crisis,
I don't think it's a crisis. I think the injury has always been there. I think the numbers have always been there. I think we are starting to get a better grasp on what they are and the seriousness of it.
Now, Dr. Broglio also pointed out there are current and former NFL players who may be suffering from other brain conditions that are treatable, but may be going undiagnosed because players just assume that CTE is really what's to blame for their symptoms.
So, problems like
depression, other mental health issues, for example. They might just assume that it's getting hit in the head too many times rather than seeking out the true source that may actually be completely treatable.
We're asking more questions instead of just going to that conclusion.
Exactly.
All right, Doc.
Thank you, Doc.